So welcome everyone. Thank you for joining us. You have joined a webinar on advancing and integrating climate and health policies, insights from 6 geographies. This is a briefing on the findings from a research study that you'll hear more about in a moment. GCHA, I'm Jenny Miller, Executive Director of the Global Climate and Health Alliance. Very pleased to have you all with us here today. And GCHA is particularly proud to be hosting this webinar. We played a small role in the research project, but are very excited about this work and what the learnings from this project offer us. We will be hearing from the researchers a presentation on the findings from this research. We will then turn to a couple of commenters to comment on the findings, and then we'll eventually get to a question and answer period. During that question and answer period, we will be taking questions from all of you. Please put those questions in the Q&A. The chat is open for you to share comments in the chat, but when we look for questions for the researchers, we'll be looking at the Q&A box, and you find that on the bottom bar of your Zoom, and just click on it and enter your answer or your question, sorry. Meanwhile, I invite all of you who are joining us to introduce yourself in the chat. Let us know where you're joining from, what organization you're with or what type of work you do. Would love to have you share who you are in the chat. But before we get into all of that, we have the opportunity to kick us off to hear from Modi Matswana, who is the head of capacity and field development for climate and health at the Wellcome Trust. And the Wellcome Trust is the sponsor of this research. And so without further ado, Modi, I'd like to turn over to you to get us started on this briefing.
Thank you, Jenny. And hello, everyone. Welcome to this webinar. I'm really excited to see so many people from around the world joining this webinar for this project that is really important for the climate and health field today. So I'll tell you a little bit about our climate and health program at Wellcome and why we think this particular project is very important. So our climate and health strategy's mission is to put health at the heart of climate action. And we have 3 goals to support this. And the first is really around fostering a transdisciplinary climate and health knowledge and action ecosystem that is enabled to respond to the urgent global challenge of climate and health. The second goal is around building a robust, action-oriented climate and health global evidence base, which defines context-specific climate action and solutions. And then our third goal is really around ensuring that the climate and health evidence that we support is actually acted on by decision makers in order to bring about change. And so the way we're aiming to achieve our mission is in 3 main ways. The first is around funding research to fill gaps in our understanding and then also identify solutions. The second is around strengthening the climate and health field through supporting collaborative networks and funding transdisciplinary research projects. And then the third is around advocating for health-centered climate action by working with different international policy stakeholders, ranging from non-governmental organizations, charities, institutions like the WHO, and governments and affected communities. So our climate and health strategy is global, and we have 5 critical integrated teams that are delivering this program of work at Wellcome. We have an impacts and adaptation team, a mitigation team, a capacity and field development team, a policy team, and a communications team. So those of you who've interacted with Wellcome may well know different bits of the Wellcome institution, but we are quite diverse in terms of our makeup as well. And so in terms of reflecting on this particular project that we are going to be hearing about today, as our strategy is global, we're really thrilled that this project is generating insights on how to integrate climate and health policies from 6 different geographies around the world. These insights will be invaluable in informing our climate and health strategy, and especially our field building efforts, because they are very much aligned with our mission to put health at the heart of climate action, and hopefully everyone's mission on this call as well. One example of how we're doing our investments is a forthcoming investment to support the development of a global network of climate and health science and policy centres. And these centres are going to start in Africa. They're going to be aiming to address a number of challenges, including the fact that research is often not relevant to local contexts in developing countries or anywhere, and it's often not aligned with priorities. There are problems around gaps in data, fragmented research efforts, and inadequate funding for research and implementation. Another challenge with some of the research in the climate and health space is that research can happen in silos without sufficient engagement of policy stakeholders to ensure that the research is relevant for them and therefore taken up. So our approach with this example of this investment is that over the next year, we're planning to support 3 regional climate and health science and policy centres in Eastern, Western and Southern Africa. And each will receive up to £20 million over 5 years. And the vision for these centres is to support a healthy future for Africa that is driven by high quality, regionally led climate and health science that informs policy and action. These centres are going to be expected to work with climate and health ecosystem stakeholders to identify around 3 policy goals that they would like to achieve within the 5-year timescale in a target set of countries, and also identify what are the critical research questions and data gaps that are needed to advance those goals. And then they'll need to develop linked policy and advocacy plans to help raise awareness of and support for key climate and health action among decision makers and members of the public. So science and policy partnerships between researchers and policy and advocacy stakeholders will be a critical aspect of the centres to achieve their societal goals. And this is just one example of how we're investing in advancing science and policy initiatives at Wellcome. So the insights from the report that is being discussed at today's meeting will be enormously helpful in supporting the design of these investments to guide better integration of climate and health policies, initially in Africa, but then also beyond. So unfortunately, I won't be able to stay for the rest of the meeting, but I'm joined today by my colleagues Neha, Louis and Sonia from our climate and health team, and they'll be here from the full meeting and listening actively on the Wellcome side. But we're very much looking forward to the final report, watching recording, and hopefully engaging and meeting with some of you as the initiative is rolled out more broadly across the world. And I just want to thank everyone who was involved in this project. And yeah, we're looking forward to engaging with you over the next few months. Thank you.
Thank you so much, Modi. Really wonderful to have that context setting for this work. And also just extraordinary the investments that Wellcome is making in understanding this space, and really appreciate the leadership that Wellcome Trust has taken in, helping to create the evidence that will enable us to get the work done that protects people's health from climate change. So thanks so much for joining us. And we're pleased to have your colleagues with us for the rest of the meeting. And now we get to hear from the research team. So to start us off, I'm going to turn over to Ed Maybeck, who is professor and director of the George Mason University Center for Climate Change Communications, and the GMU Center for Climate Change Communications played the coordinating role in this research. So to tell us what the synthesis of this research found, I'm going to turn over to you, Ed. Take it away.
Thank you, Jenny, and thank you, Modi. That overview of Wellcome Trust Climate and Health Initiative is not only helpful, I think, to all of us, it's helpful even to me to understand the context in which the research that we're now going to brief you all on fits in. And it's really nice to see how closely this research is aligned with the broader initiative. I also want to start with a bit of a very broad, taking a step back and giving a very broad overview by refreshing us or introducing all of us to perhaps a chapter in history that few of us know about. But fortunately, it was not lost to history because in around the time that the U.S. that America was trying to separate itself from England, 1747 in specific, a Scottish naval surgeon by the name of James Lind conducted a clinical trial with sailors on the British Royal Navy. The issue that he was trying to answer, the question he was trying to answer was, what can we do to prevent scurvy among our sailors? Scurvy was, the plague of sailors worldwide from time immemorial. And Dr. Lind was thought that the introduction of citrus, lemons, orange, etc., grapefruits, into the diet of sailors may well prevent and even cure scurvy. So he conducted a clinical trial. The results of the clinical trial were absolutely unequivocally clear. Citrus did, in fact, not only prevent scurvy, but also treated sailors who had already developed scurvy. This was an important, life-saving, world-changing innovation, okay? The results of which were known in 1747. It took another 48 years, however, for the introduction of citrus into the diets of British sailors to become official policy of England. 48-year delay between when the research was done, a clear answer to an important question was now obvious, and it still took almost 50 more years to get it to implement it into practice in the Navy, and another 70 years on top of that for it to become the official policy of Great Britain's merchant marines. So 120-year lag between a clear answer from research and full implementation, at least in British society. And to me, this is an incredibly important reminder of the fact that life-saving, world-changing innovations do not implement themselves. They have to actually be fought for. People, the answer from the research is really only the first step. The hard work comes after that to make sure that the benefits of these innovations are actually put into practice. So Julia, if you could go advance the slide, please. Let me tell you all about the central research question that my colleagues, who I will introduce you to in a moment, and myself came together to answer. And the research is perfectly clear that there are profound health benefits when climate policy is done well, and there are profound climate benefits when health policy is done well. The answer, we know that from the research. There really is no confusion about that point. But the question that we came together to answer is, where are we in the state of implementing the integration between climate policy and health policy in a handful of nations around the world? We chose nations that we thought were to some degree, we chose nations in which we had willing partners to do this work, but every one of these nations we think is representative of other countries in their regions. So in addition to answering the question, are national climate policies and health policies being integrated? And if not, should they be? Do the policy stakeholders feel they should be? And in what ways would they like to see them integrated and how? So the 6 countries that came together to do this work were Brazil, not countries, I walked that one back, the 6 geographies, because the Caribbean is a geography, not a country. Germany, Kenya, the UK, and the US. So you will hear from the lead researchers in each of these countries. Next slide, please. Our Brazilian partners are at University of Sao Paulo. Our Caribbean partners were actually in universities across the Caribbean, but organized by the University of West Indies in Jamaica. Our German team was at the Center for Planetary Health Policy. Our India team was at the Center for Chronic Disease Control. Our Kenyan team at the University of Nairobi. Our UK team at both the London School of Economics and the University of East Anglia. The US team was headquartered here at George Mason, but we had had partners at Yale and University of California as well. And finally, our partner at the Global and Climate Health Alliance. Next slide, please. Just a brief tip to that of my hat and my thanks to my team members, Josh Ettinger, Julia Fine, John Kocher, Matto Mildenberger, and Tony Leiserwitz. We are, it's been a real pleasure to have this team. We are actually a team who work on many other projects together, so we didn't come together for this project, but this has been perhaps one of our most fun and most fulfilling projects together. Next slide, please. So the methodology that we used, continue please, in total, across the 6 geographies, we interviewed a total of 225 senior stakeholders, people who are actually policymakers or who work for policymakers or who work for the, in government organizations expected to implement policy, and or researchers and members of the advocacy community. So across the 6 geographies, we interviewed 225 people. These interviews were conducted between January and July of last year. Next point. We intentionally interviewed people who have expertise and a focus on climate, other people who have expertise and a primary focus on health. As you can see from this slide, approximately 70 of them, 70 of the stakeholders that we interviewed also sort of worked directly at the interface, the nexus of climate and health, but not all of them. So some of the people, health policy stakeholders, were focused exclusively on health, others exclusively on climate. And another 36 people that we interviewed, we consider them working in climate and health adjacent areas. Things like agriculture, transportation, housing and urban development. Next slide, please. Here's simply the distribution of who we spoke to across the 6 geographies. Obviously, you can see that the primary group that we were able to interview were fairly senior level civil servants, people in ministries or government agencies who were high enough up to be interacting at the policy level and really had the best overview of sort of where things stood in their nation. As I said before, we also spoke with legislators and their staff, academic experts, think tanks employees, as well as advocates and people in the NGO sector. Next slide. So let me take you very quickly through the key findings. The whole report, we will show you a link so you can download the report for yourself at the end of this webinar. Next slide. So beginning with the big picture, what is the current status of integration between climate policy and health policy in each of those nations or geographies in which we conducted this research? The answer is not very much. Climate policy, health policy in these nations and regions remain relatively siloed. We make the case in our report that there perhaps may be slightly more integration in Germany, Kenya, and the UK, but it's not really a huge qualitative difference. The real answer is the integration is just barely, it's in its very first stages. A lot of work to be done. Next point, please. The places where people, the stakeholders that we interviewed, saw integration as becoming, most obvious or at least beginning to take hold. Some of the countries are beginning to consider health in their national climate policies. Jamaica's climate and health policy, for example, does include an explicit section on health, which is a really good thing. Some countries are beginning to consider climate in their health policy. So Kenya has a health policy framework that acknowledges the importance of climate change. The UK has their Greener NHS initiative, which is very directly about helping to make the healthcare delivery sector in the UK more climate friendly, if you will. And across all of these geographies, there was a lot of talk about the fact that the areas where it looks like it will take root earliest will focus on air pollution, transportation, and extreme weather preparedness. Next slide. Here's just a quote from a UK policy advisor who we think sums it up rather nicely. He or she said, my perception is that there are definitely links to health and climate. It's definitely there in the documents. However, there's a lot of superficiality saying that we're linking them, acknowledging that we ought to link them. And this is how we are linking them, but it actually doesn't actually do it. They are not actually getting it done yet. Next slide, please. So the next question that we put to our interviewees is, well, okay, so the integration isn't yet happening very fully. What would the ideal look like in your eyes for integrating national and climate and health policy? There was, again, a lot of consensus. The degree of consensus across the geographies was really striking, that yes, this is a good idea. This should happen. And the areas where we think it should happen first and most fully focus on agriculture, nutrition, and food security, of not only mitigation, but adaptation and resilience as well, emergency preparedness and disaster response, and the way we are developing and supporting our communities. All of these places are obvious places to be furthering the integration of climate and health policy. Next slide, please. Oh, next point. Thank you. In people's answers to their articulation of what the idea looks like, they sort of spontaneously mentioned a whole variety of things that they consider to be absolute I won't say mandates, but really important objectives. The first one is perhaps the most important. We need the funding to do this work right. The funding isn't there yet. The second point was that we really should be developing national legal frameworks or strategies. So this ought not continue to be sort of a haphazard approach, but we really need a national strategy, and it really needs to be codified as such. And then finally, they perceived both the opportunity and the mandate to make sure that there was principally a focus on equity and justice in the work. Next slide, please. Another quote that we thought was illustrative from a stakeholder in Germany with a national health association, who said that the advantages of a stronger integration of climate and environmental issues in health policy would be that if you would have to do less repair work afterward. In other words, if you took the efforts, if you took the effects of certain political decisions on climate change and how they're related to health into account from the outset, you would no longer have to readjust or repair the situation afterwards. Next slide, please. So if important innovations don't implement themselves, what is standing in the way? That is the next question that we put to our stakeholders. And they gave us a very compelling, very clear set of barriers that they felt were really absolutely had to be addressed if we are to make significant progress. And the first of those barriers is that both the government institutions as well as the professional communities who sort of support those government institutions, that would be climate ministries, health ministries, the climate community, health community, they are siloed. And it's the fact that they are siloed and they are not talking to each other, not linking arms and working together on these issues is the most clear, most important barrier that we heard. The next slide, next bullet point, please. We heard very clearly that when administrations change, and unless there is adequate institutionalization across the government ministries or agencies, as institutions change, the priority could fall right back off the radar of these ministries. We heard that as a very clear barrier. Next bullet, please. We heard a lot about the inefficiency and the bureaucracy. Change is hard in government. We all know that to be true. Next barrier, please. We heard again a lot about the lack of funding to do the work. We heard a lot about the lack of data and access to data that does actually exist. We heard a lot about the fact that the ministries don't yet have the qualified personnel to do the work, and the fact that there are competing priorities. This is by no means the only priority. It has to be prioritized if it is going to compete well with the other government priorities. Next point, please. We also heard a lot about the fact that really in most of these geographies, there is very poor uptake of evidence in policymaking. In other words, policymakers are attending to um, other voices, not necessarily the voices of people who are collecting the evidence, or not necessarily even attending to the evidence directly themselves. Next point, please. Obviously, the influence of vested interests. We heard that from stakeholders in every country. And the final barrier, the fact that that policymaking is slow, and that until there are legally binding policies, it will always be sort of haphazard in moving the needle forward on these priorities. Next slide. Oh, I'm sorry. The final barrier that they talked about, that we heard about in every one of these geographies, was really the lack of public awareness about the connection between human health and climate change, and therefore the lack of public demand to actually for governance that actually addresses those, protects both our health, the health of our people, as well as the health of our climate. Next slide. A Caribbean health policymaker said it very nicely. We're in a country that will switch a government out at the blink of an eye. We don't build on what the last government has left in place. It's like you're rebuilding a house every 5 to 10 years, and you're digging up what was built instead of putting on a roof and doing the finishings and bringing in the furniture. Really a nice summary on the challenge of it. Until you have real institutionalization across government, it's going to be difficult. Next slide, please. The next question we ask our stakeholders is, well, where do you see opportunities? Where are there developments and resources that aren't yet being optimally harnessed to do this important work? The first thing we heard was a very clear acknowledgement of the co-benefits, the fact that climate policy can produce health benefits and health policy can produce climate benefits, and the fact that that is a largely untold story, or a not adequately well-told story. People saw that as a very clear opportunity. Next point, please. Many of the stakeholders acknowledge that there is an increasing awareness of this overlap, these co-benefits, but it's still in a fairly nascent stage. Next opportunity. The fact that there is growing international momentum on this point, bringing health into the climate conversation at the COP26, COP28. We hope to see health having a major focus upcoming in COP30. The World Health Assembly last year, the fact that the health ministers of the world issued a climate and health policy statement, and the fact that a growing number of countries are building health into their national climate plans. All of this is seen as providing some helpful momentum. Next point, please. COP30 upcoming in Brazil later this year, other national and international policy deliberations. All of these create opportunities to continue to make the point that there are these incredible opportunities for co-benefits to help multi-solve for both planetary health and human health concurrently. Next point. The fact that there are not rapidly necessarily, but there are emerging resources, both in terms of funding, in terms of data, and in terms of clean technology, clean tech, clean energy, if you will. All of this is creating helpful opportunities to drive this integration forward. Next point. And then finally, the fact that there are emerging frameworks, intellectual frameworks, if you will, that are helping people, including potentially helping policymakers, understand the relevance, the fundamental interconnectedness between human health and the health of our planet. And those frameworks include the One Health framework, as well as the Planetary Health framework. Next slide. So this quote from a parliamentarian in Brazil, we think that makes that point nicely. They said the debates around the COP will necessarily move Brazil. We will be open to the whole world as the host of this issue, which is fundamental and impacts all future generations. It's a window of opportunity, less because of the event itself, but more because of its preparation, construction, and presentation of the climate issue to Brazil, business people, and the political class. Next slide, please. So we heard about what you might call low-hanging fruit, opportunities for action that seem particularly feasible even in the current political environment. First point being incorporating climate change into national health policies and vice versa. There are countries who are doing this, our stakeholders seem to think that that was perhaps one of the less heavy lifts, and yet an incredibly important way to sort of pave the way for further integration. Next point, please. We heard a lot about incorporating climate and health into these climate and health adjacent policy areas, including agriculture, housing, and transportation. Next point, please. We heard a lot about the fact that in many of these geographies, there are some existing policies, but they're not necessarily fully implemented yet. Therefore, that should be low-hanging fruit as well. And the final point, we heard very, very clear articulation of the need to up our game in terms of doing educating people about not only the integration of the problems, the fact that climate change harms health, but the integration of the overlap between the opportunities, the fact that climate policy creates health benefits, health policy creates climate benefits. So a real need for more coordinated education and outreach. Next slide, please. With regard to recommended strategies, we heard a whole bunch. The first one being that we need to see enhanced collaboration, right? That first barrier that we heard about was silos. So the first recommended strategy is, okay, break down those silos, create opportunities, mandate collaboration between those working on the climate, those working on health, and those working in the climate and health adjacent institutions. The next recommended strategy we heard was about embedding climate and health programs into existing institutions. We don't need to create new institutions. We can embed them into the institutions that we already have. It's easier to get them to do new things than to create entirely new institutions. Next strategy we heard about was the simple idea that we have all heard about for a long time, but most geographies have made relatively little progress on, and that is introducing the notion of that we should be considering climate in all policies, and that we should be considering health in all policies. And that really, I think that gets us back to what the German policymaker or the German our German spokesperson, who I quoted before, the point that they were making, which is when we do this, we don't have to go back and fix the mistakes that we have made. Next strategy that we heard about was incorporating more citizen input into the policymaking process. Because when there is citizen input, when there is input from a diverse set of voices, we are much more likely to be considering climate in all policies, to be considering health in all policies. We also heard about the fact that there are existing success stories out there, sometimes at a smaller level of government, local or state or provincial government, sometimes from governments overseas. But we have the opportunity to scale up successful programs or adapt programs that have been shown to be successful elsewhere. And then the final recommended strategy that we heard was simply promoting a greater focus on the evidence in policy making, which means bringing in voices that will advocate for the evidence, that will explain the evidence, that will make sure the evidence is relevant to policymaking. We heard about maximizing the accessibility and use of existing data sources, because they too tend to be siloed. And perhaps most importantly, we heard about the necessity to do research that is useful to policymaking and not just research that is seen to be somewhat arcane and irrelevant by policymakers. Next slide, please. Oh, I'm sorry, one last recommended strategy. And that would be to activate citizens and advocacy organizations to apply pressure on policymakers. If they're if the citizens, if the people aren't applying pressure, the policymakers have no particular mandate to consider the things that we would like them to be considering. Next slide. A quote from a climate advocate in Kenya nicely makes this point. From what I've seen over the past 10 years on the evolution of climate policy, what has been influencing policymakers is their knowledge and understanding of the issues. If they don't know what the issues are, they will not be able to make policy because they can't do what they don't know. Therefore, they need to be sensitized either through policy briefs or through training. Next slide, please. So we heard a lot about communication strategies that our stakeholders feel are promising. The first point being just again, this notion of breaking down the silos by encouraging communication by these two distinct communities, these communities that aren't yet talking to each other yet enough, the climate community and the health community. The second communication strategy you heard is about framing climate change, the relevance of climate change in terms of human health. Our team's research at George Mason, we've done a lot of research on this point, and what we have found is that when you bring the human dimension into what is otherwise seen as an environmental problem, it really does create opportunities to bring new voices, to focus everybody on the issue in ways that is more personally relevant to them, and to bring new voices into the conversation. Next point we heard was to quantify the health impacts and quantify the health benefits of climate action, because that's something that is largely missing at the moment. The next recommendation we heard was to activate the voices of health professionals in this conversation. They are highly trusted messengers. Super important that we get them to use that privileged position of trust in their communities to bring others to bring these issues and these opportunities to policymakers. Next one we heard is simply the fact that obviously you can't use one set of messages to activate all audiences. There's many ways that we can tailor this narrative to work effectively with many different audiences. And finally, oh, I'm sorry, a great quote from a congressional staff member. Thank you, Julia. It's so important to have public experts on the Hill, on Capitol Hill, on our US legislature, talking to us in order to ensure that we understand these complicated issues and we're able to translate them to our bosses. Finally, in our report, we go into implications for each of a variety of different important stakeholder groups. The first one, and perhaps the most important group, are presidents, prime ministers, and their staff. These are the people whose leadership we need. These are the people who, when they lead, it really does accelerate implementation, accelerate progress. They have the opportunity to modify governmental structures and to require collaboration across the different arms of government, and they are the ones who are in the best position to call for the development of a national plan. The second group we focus on is members of Congress, Parliament, and other national legislative bodies. They are the ones who they are the ones who can help us pass the problem of the change in administrations. When the legislative bodies enact policies that have the potential to endure, it really does become the kind of mandate that can carry through for government ministries, for the long run, because this will require work over the long run. The next group we focus on are civil servants. They're the ones who are obviously doing the hard work. They can, even when their politicians aren't necessarily leading, they can do incredibly important work themselves within their own ministry, within their own government agency. They can mainstream the issue, and they can make linkages to other ministries, other government agencies who are also working to mainstream the issue. We focus a fair amount on what the opportunities for health professionals and health organizations. Obviously, they have an incredibly important role in engaging with policymakers, in articulating to the public why and how climate change and climate solutions are so important if we want to make sure that we're attending to the health and well-being of the people. The same is true of climate professionals and climate organizations. They too really need to make more effort to engage with policymakers to try to speak in human terms, not just in terms of impacts to the climate. Members of the research community, they have work to do. We have work to do in terms of doing policy relevant research, not necessarily the research that is of greatest interest in advancing the science, but is of greatest interest in advancing implementation of necessary policies. Another group we focus on is the philanthropic community, who government funding is by necessity limited. And especially now in the US, as I'll mention in a moment, we're seeing a real retrenchment. And so we're waiting. We need the philanthropic community here in the US and in other geographies around the world to step up and show some leadership. And then finally, the advocacy community. Ultimately, if the voices of the people are not demanding that this be a priority, it is not likely to be a priority. So with that, I would like to actually move forward. Next slide, please. And have ask all of my co-PIs on the project to reflect a little bit additional what they've heard in their country or their geography, and any other comments that they would like to add to what I've shown. So we're just going to go through, beginning with our colleague Sophie Gepp in Germany, moving then to our colleague Georgiana Gordon Strong, then to Richard in the Caribbean, excuse me, then to Richard Mulwa in Kenya, Tim Rayner in the UK, and finally Antonio Saraiva in Brazil. And then I'll come back in and give you a couple of final comments from me. So Sophie, over to you.
Thank you so much, Ed, and thank you to all the coordination team. Good afternoon from Berlin. I'm Sophie Gepp, and I coordinated the German part of the study. And in addition to the presented findings, I will just give a short glimpse into some specific points that came up in the German interviews. So Germany has recently seen progress with regards to the integration of climate adaptation and health, for example, in the context of heat protection and the respective strategies and policies. However, less progress has been made with regards to the integration of climate mitigation and health. And in our interviews, a recurring theme was the need for a national strategy on climate and health, including measurable goals and indicators to actually track progress. Furthermore, an interesting finding from our interviews was that while many participants, as Ed just highlighted, found the health frame useful for making the individual and current impacts of climate change very visible, there was a point that was especially made by a few of the non-health actors, which raised questions and doubts whether the focus of the focus of the health frame might risk also individualizing the problem. And this points to a need to also include prevention and the determinants of health in the health frame or when using the health argument. Additionally, there was a articulated need for policies that target the systemic and transformative change that is needed beyond short legislative cycles. And this is especially important in Germany since federal and state elections are happening at different points in time. So in a way, there's always an upcoming election, which makes it hard to have policies that have a long-term view. So this was a finding that was quite prominent as well. And finally, our interviews underlined the need to create specific mechanisms and structures to work across sectors, and ways to consider justice and equity in policymaking. This was a very short glimpse into our data. Thank you to all the interviews, the coordination team, and welcome. And with that, I pass on to the next speaker.
Thank you, Sophia. I'm Georgiana, and I'm representing the Caribbean team. I think much of what was said in the findings resonated with what we found. Our project resonated really well with the policymakers that we interviewed, and it now serves as a status report on the integration of climate change and health in the Caribbean. Given the vulnerabilities of the Caribbean, being small island states located in a hurricane belt, and with a heavy disease burden of chronic non-communicable disease, the findings reiterate the need to accelerate the integration of climate and health. It calls for addressing the challenges, though I think a deeper challenge, which is one of developing multi-sectoral policies. You heard before from Ed that some of these barriers or challenges were due to the siloed nature of government, the lengthy process within which it takes to make policy, and also the problems that arise once an administration changes, that the policies are dropped, and sometimes there's not a continuation of what was good and what was happening well. So for us, this project emphasized the need for an enabling environment to address the existing barriers alluded to earlier, and the leveraging of opportunities for improving technical and financial resources. It also emphasized the need for mitigation strategies. We're in a tropical zone and have quite a bit of sunshine, for the utilization of renewable energy. And that has been happening for some of our health sector. I think most of our policymakers, or all of them, had as an ideal that these policies, health and climate change, should be integrated. However, the link between the two right now are nascent and also tenuous, So this project provided for us, I think, a clarion call for action in terms of the policy prescription that we need to follow. We have many suggestions of how we should proceed. Should it be climate in all policies? Should it be a planetary approach? Should it be a One Health approach? But I think we need to really make a decision around this and to determine what should be included and what shouldn't be included, what should be linked and what maybe should not be linked. But I think more importantly, for me, this project showed that we need to design, develop, or find the pathways to achieving the ideal that we would like, which would be the integration of climate and change into health policies. I'm sorry, the integration of climate change and health policies. Thank you. Over to the next speaker.
Yeah, thank you very much. And I'm Richard Mulwa, the lead of the Kenyan team, and I want to present a few highlights. What came out from the Kenyan study, and what we found out was that climate impact on health are known, but only to the technical experts in both sectors, that's in health and in the area of climate change. And we are saying that we need to broaden this understanding to other actors. We also see as a weak nexus due to largely lack of awareness. There's also an availability of data in this area and weak institutional and knowledge linkages. We're also saying that there is progress and change in policy development within the nexus, but also important is an integrated approach that incorporates health into climate change resilient strategies that is also emerging at this point. We also believe that positioning of health in policy and economic spaces is very important, as it will attract more attention of the political class, as is the case in climate change. Right now, climate change has a lot of political goodwill. So if we could push forth similar initiatives and have a similar approach also for health policy, then this would help a lot. We're also saying that we need to strengthen climate health data research, advocacy, awareness creation, and institutional collaboration. Finally, we are saying that we need to leverage on strategic health and climate opportunities at the local and the global level. So that's the highlight from Kenya. The next speaker, please. Thank you.
Hello, my name's Tim Rayner. I'm speaking on behalf of the UK team, but based at the University of East Anglia. Compared to the other countries, I think the UK has enjoyed some advantages from having pioneered the concept that climate change targets should be embedded and continually monitored legally in law. So that's encompassed the health sector of government policy as other sectors under the Climate Change Act passed in 2008. So the national net zero target for 2050 has had the highest profile from the Climate Change Act, I think, but commitments to adaptation and resilience are also there, and also require periodic reporting by relevant authorities, including for health and social care. So our interviewees recognize this as important progress for integrating health and climate agendas. And they also recognized initiatives that we've heard Ed mention earlier on, such as the Greener NHS unit, which was set up around the same time scale as the Climate Change Act. Originally as the Sustainable Development Unit, concentrating at first on identifying opportunities for reducing emissions, but also latterly becoming more interested in resilience to climate impacts too. But while these constitute progress, they still lead much to be desired, I think, is the take-home message from our interviewees. They still leave vast opportunities for co-benefits between improving public health and improving climate policy outcomes untapped, sadly. And our work found that the implementation of these high-level commitments has been hampered by some of the factors that Ed, I think, has highlighted there. So we find that those who've taken it upon themselves often to act as policy entrepreneurs to make connections between climate and health are too often under-resourced and lacking a network of counterparts that they can work with, and their work is hampered by priorities and policy-making processes that are set and determined elsewhere. It's also worth stressing, I think, some of the interesting elements that we heard from our interviewees regarding the production of data and evidence and decision-making needs. Often the outputs of national level research assessments aren't particularly useful in a local context. That's one aspect. But also decision makers often require evidence justifying the value of a particular policy intervention to be packaged in particular ways that might disadvantage some of the bolder, more system level type interventions that might be contemplated. So there's an argument we've heard, and you can hear it interestingly from some of the respondents in our launch event video, an argument for accepting other forms of evidence to give certain ideas a fairer hearing. Sometimes an argument for declaring that the urgency of the situation and the crisis is such that we can't wait necessarily for elaborate evidence bases to be developed before making some important decisions. So yeah, thanks for giving me the time just to give you a flavour of the UK report. Thanks to my my colleagues on the UK team, and yeah, thanks to GMU for the project as a whole. And I will now pass on. I won't say to you two in case I get it wrong. I think it may be Ed.
To Antonio.
Oh, I beg your pardon.
Thank you. Good morning and good afternoon, everyone. It's my pleasure to highlight a few points from our report in Brazil. I'll start with some opportunities. Brazil has an international competitive advantage in having one of the cleanest energy matrices in the world, mainly hydroelectric, strong growth in wind and solar energy power, sugarcane ethanol as a fuel already consolidated, and investments in green hydrogen. Therefore, the country can lead the energy transition. Also, the greenhouse gas emissions in Brazil come mainly from land use change, specifically from deforestation and burning, mainly due to agriculture, but there are command and control policies, so mitigation can be achieved by applying those policies without affecting other economic sectors. So it's a question of political will, not as a simple thing, but it is. Other opportunities, our unified health system is consolidated in all parts of the country and has great potential to incorporate the climate agenda through health professionals as multipliers and as trusted messengers, as Ed has already highlighted. We have a national climate plan being developed and implemented is an important opportunity as it crosses many sectors and ministries that are sitting at the same table and struggling to make it move. COP30 is also a great opportunity, as it was mentioned before, as it is mobilizing civil society, the government, and the private sector for its preparation, and because the country will be in the global spotlight. As barriers or maybe challenges, you can think of them both ways. The political polarization has worsened in recent years, surely not only in Brazil, and many are legislating in the interest of a few to maintain vested interests. This compromises the development and implementation of a national strategic plan without the contradictions that are common in more narrowly focused policies. And as in other developing countries, one of the main challenges is how to promote development with social justice, while simultaneously implementing adaptation and mitigation measures when there are important historic structural problems, inequalities, and a strong concentration of income. So these are some points from our report. Thank you again, Ed, and back to you.
Thank you, Antonio. And I just want to make a few more points. Julia, just go ahead and bring them all up if you would. Obviously, the situation here in the US has changed dramatically in 2025. Under the past administration, we had really remarkable progress in terms of bringing climate and health policy together at both the federal level under President Biden, as well as in many states. So the point and the fact that right now under President Trump, we're going in the exact opposite direction at breakneck speed. So it just really reiterates to me that the fact that political leadership really does matter, both for progress as well as creating reversals. Even though our federal government right now is headed in the wrong direction very fast, we are continuing to see, and will continue to see progress in certain states and in local jurisdictions and other sectors of our economy. So, what happens at the national policy level is not the whole story. And integrating climate and health policy at the subnational level and in the private sector, that's important too. And then I just want to end my thoughts on reiterating one final time how important health voices are or can be in this conversation. If we don't show up to give voice to why this is important, the most compelling, the most trusted speakers will be left out of the conversation. We really do have a mandate to show up because of the deep integration between human health and planetary health. With that, Jenny, I turn it back over to you.
Fantastic. Thank you so much, Ed, and all of the researchers for the excellent briefing about the findings of the research. Really, really interesting. So now we're going to get to hear from Dr. Diarmuid Campbell-Landrum of the World Health Organization. He's the Climate Change and Health Unit Lead, and he's going to provide some reflections on the research. And then we'll also get to hear from me with a few thoughts of my own about this research. And then afterwards, we have quite a number of questions coming in the Q&A. It's really great to hear. This has prompted a lot of interest. So we'll turn to all of your questions, as many as we can get to, after a few reflections from Diarmuid and myself. So over to you, Diarmuid.
Thanks very much, Jenny. Can I just first check you can hear me and see me okay?
Yep, you sound great. You look great.
Ah, so kind. Brilliant. Well, thanks so much. And I'll try and keep these remarks short so we can get on to Jenny's remarks and then to leave as much time as possible for questions and answers. But first off, I'd just like to start off with some thanks. I mean, thanks very much to the GCHA, to the GMU team, to all of the researchers that have contributed to this really interesting piece of work, and also to the Wellcome Trust, who I think have played an absolutely instrumental role across a wide range of disciplines in ensuring that this critical area of work doesn't go unsupported, irrespective of the changing political winds in different parts of the world. So a huge thanks to the team. And I'd also like to thank everybody for a really interesting webinar. I don't think there are many webinars that will get you from scurvy and citrus fruit in the 1750s to the position of the US administration in an hour, but this webinar has done that. And in fact, I'm going to take that as the lead-off point for my remarks, because I've been listening with interest to all of the interventions. And I think that the points that have been raised are, they are pretty hard to argue with, I think. And to be honest, I think we've heard many of them reflected in different ways across different issues that we've dealt with in terms of environment and health research and action, or anything to do with the determinants of health, which goes outside of the narrow remit of what gets done within hospitals and within ministries of health. Those challenges of the difficulty of working across sectors, siloing, trying to ensure political engagement in the face of shorter term interests and vested interests and so on. These are problems that we are familiar with. And I think it's a really good basis to focus our minds to say how we're going to address them. One of the points that I wanted to start off with was just the importance of having a clear goal. And I'd even go back to that example that Ed gave at the beginning with scurvy and the intervention. I hope it's not politically incorrect to say this. I don't think it's too soon. It's sort of 250 years ago since that example. But there was a clear goal there on behalf of the British Navy, which was to keep British sailors fit to fight French sailors. I say that also because I am a French citizen as well, so I'm sort of neutral there. But it was very clear that there was an objective there, and that you could sum it up, and it was clear why you were trying to do what you're trying to do. And I would say that would cut through in a way that is faster and more direct than talking in general terms about the need to make the nexus between feeding policy and fighting effectiveness or whatever. It was just a clear goal. And I think we see this where we have got much faster action on things like the development of the COVID vaccine. That was done in absolutely record-breaking time, because it was very clear the world needed a COVID vaccine, and that was done faster than any equivalent intervention, I would say, in the history of health, because there was a clear goal. So that's point number one. So be able to articulate your goal very simply and clearly. The second is on leadership, and Ed touched on this as well. Although it may have taken however long it took, 150 years or so, for that intervention to have become official policy or internationalized policy, leaders in this field were doing that pretty soon after the intervention was identified. Most successful leaders were already doing it. They were buying limes for their ships. So I think that we have equivalent stories in the climate and health world. You have, for example, city leaders in London or in Paris who have identified action on ensuring that the air in their cities is fit to breathe for their citizens, and that relates to climate change. And with that clear goal and with their leadership, even in the absence of complete unanimity of national policy, they've taken really effective, quite strong action, and been politically successful with it, re-elections repeatedly in each case. So I think we should be also trying to highlight that role of leadership, and also to shine the spotlight on those actors who are right at the forefront of this. I think another point that I'd like to emphasize, again, it's been made before, and that's diversity in the kind of evidence that we deploy. I've worked on, I have a research background. I've been on various IPCC reports, but sometimes if I think of how I'd like to sum up the IPCC after about the third assessment report, it's a stereotype, but I would say the message of IPCC reports after that time is, we told you this. We told you it was going to be bad. We're absolutely clear on the evidence. And then it's sort of fine tuning or providing more detail maybe on what you can do about it. But the technical evidence that climate change was a problem for humanity was in place more than 30 years ago. And it's the diversity of evidence of what are effective interventions, what kind of constituencies do you need to bring together behind action? What are the barriers in building political will, for example, which is also the kind of evidence that is at least equally relevant, I would argue even more relevant now than the hard physical science on addressing this crisis. And just to keep my remarks short, the final point I wanted to make is that I think, again, speaking as somebody from a research background, we can sometimes have a tendency to assemble high quality evidence, and we need high quality evidence. We have a lot of it. Of course, we need to continue doing that. And then say the answer is clear, and then say, but the issue is the lack of political will, and sort of shrug our shoulders and lament that we've done our job, but what are you going to do? The politicians aren't acting. That, I think, for the community as a whole, needs to be almost the starting point. If there isn't political will, and yet the evidence is so clear on what we need to do to protect people's lives, to protect the environmental and social determinants that underpin people's lives, and that means protecting the health of the planet. If the evidence is so clear, which it obviously is, why isn't there political will, and how are we going to deploy that evidence and be quite specific about the levers that we might be able to pull in order to build that political will and give options to policymakers that they can actually act on in order to drive this change? Because, as I've said, we have good examples of where there has been political leadership, there's been a diversity of kinds of evidence, and there's also been a diversity of voices deployed behind it, which has actually managed to build that political will and address that issue. But as I think Ed said, on its own, these things don't implement themselves. We need to, be able to deploy that as a community, and that will take partnership between researchers, policymakers, and so on. So thanks very much again for the opportunity to participate, and I'll hand back to Jenny.
Thanks so much, Dermot. And for my reflections, I'm going to pick up on sort of where you left off and kind of defer to your more articulate framing of this. But I think there were sort of three key things that stood out for me with this report. The first is the point that you were just speaking about, Dermot, and that translation from the robust evidence that we have about climate change and about the climate change impacts on health, the opportunities through climate action for health. That evidence is robust. There are places to fill in between the lines, but it's quite robust. But what this study highlights is that in response to that problem of that evidence not yet being translated into policy and implementation, we don't have to just flail around. We can actually research the question of how we move that robust evidence into policymaking and ask questions about what those barriers are and how we approach those barriers. And that's what this study has done. And I think more of this type of research is really important and valuable and needed to guide our work. Secondly, the degree of agreement and alignment, there were some differences between the geographies studied, but the degree of alignment on key findings, to me, indicates that there are immense opportunities to learn from each other internationally. So if we're doing work that moves policy in one country or another, we can share that information with one another as a global community working on these issues, learn from one another, take those lessons, and do better, faster, accelerated work together by learning, taking those lessons from one another. And then finally, the third thing that really strikes me from this report is it provides us a detailed roadmap. It really gives us insights as to where to focus our efforts. And it does so not only in kind of generally, but also by teasing out the different roles of different players. It clarifies, specific roles that, for example, health professionals and health advocates, like the members of GCHA, where we can jump in, but also who we need to be talking to, who else is part of the team that can make this integration of climate and health happen. So those are my reflections on the report. I think now we have about 15 to 20 minutes to take questions. We're not going to get to all the questions. There are quite a number of questions, and they're all quite great. but I'm going to put out a handful of these questions so that those on the research team can sort of pick one that they want to respond to, put their hand up, and speak to that question. So a first couple of questions centered on if we're not yet seeing the integration of climate and health policy, how do we know it's beneficial? Like where's the evidence on the actual specific benefit of that integration? So that's one question. Another question came in that was centered on Asian countries, but I don't know that it's, I think it applies to other countries as well. Considering the financial constraints in this questioner asked that many Asian countries are facing, what funding opportunities or models exist to facilitate the effective integration of climate and health policies? A third question, was there any discussion around the importance of active direct community mobilization and greater action through nonviolent direct action? So that community activism, did that feature in anybody's findings? And then a fourth question, and I'll leave it with these four to start with. Did any policymakers or interviewees also talk about the stakeholders and actors that would benefit if there's not this integration of climate and health? So who has an interest in this integration not happening? So let me pause there and see if anybody would like to step up and respond to any of those questions.
I'm going to speak to the third question, so I'm going to ask if any of my collaborators would like to speak to either of the first two questions. Jenny, you want to go ahead and briefly restate those two questions?
So the first two questions were, if the integration is not yet happening or is only moderately happening between climate and health policies, how do we know it's actually beneficial? So that's sort of the first question. And then the second one had to do with financial constraints. Given financial constraints, in this case in Asia, but also in other regions or countries, what are the funding models, funding opportunities to facilitate effective integration of health and climate policies? And I know you all did find that funding and resources were one of the challenges and the constraints. Yeah, Antonio.
Yeah, I can try to speak for the first question. The thing is, climate and health are interconnected. There's no way to think that they're not connected. And either we deal with those things together, or we'll face the problem, the issue of trying to deal with health questions after the problems happened. That's what happened, for instance, in Brazil, in many cases last year, not to mention other years, in which we had huge floods in the Rio Grande do Sul state, fires in the Amazon affecting people's ability to breathe, etc. So it's so clear that they're connected. So if we don't tackle the climate problem and the environmental problem as a whole, we will end up by having to have more problem, more costs to deal with the health problem. So it's a problem of prioritizing the money, which is limited, to tackle both things at the same time. Otherwise, we would have to tackle that time after time, because things will be recurring. So yeah, for me, that's a point.
Thank you. Yeah, Ed, do you want to come in now?
I was actually hoping Sophie might speak to the funding models, because I think that this notion is something that the German team has been really looking at very closely.
Yeah, thanks so much. I can give a short glimpse. So I think what came out in the German report was quite strongly that when there's little funding, also within government, there's competition for funding, and that ends up impeding the collaboration effectively, because who's going to pay for our joint effort, and who can report their results. And one idea that was mentioned was joint budgets between agencies and sectors to strengthen intersector collaboration. So that may be shortly to that. And I could also shortly speak on the who benefits question, but I will first leave the floor to the other speakers and pick it up later if needed.
That'd be great. Georgiana, do you want to add anything about funding models?
Yes, I wanted to add a little bit. For the Caribbean, we've been working with the Pan American Health Organization. So sometimes the funding models are not necessarily within government, although there is funding, that additional funding provided by some of the governments. But for health in particular, we've been working with the Pan American Health Organization with their Smart Health Facility initiative. And this has also helped us with developing our national health adaptation plan. So right now, quite a few of the Caribbean countries have been working with PAHO to develop their, what we call an HNAP, which is a Health National Adaptation Plan. So what we have been able to do is, I suppose, leverage funding opportunities outside of government to try to put forward or to move forward our health and climate activities and policies. Oh.
And Richard, care to add anything to that?
Well, hardly are you going to find any funder that is funding both streams at the same time. In most cases, you have funders for climate change and funders for health. And going to the future, we might need to have models that work for both. I don't know whether we are going to have interested funders, but the moment we bring this to the limelight and show or demonstrate how important this is, then we might have or attract funding agencies, local or international, that might want to get into this arena of funding both climate and health. So, but currently now I think it's just siloed, as we said earlier. Yeah.
So I'd like to jump in on the question of community activism and the related question of activism in the health community, because this is, you know, our colleagues in the UK, our health colleagues in the UK have been really very much on the front lines of showing up, you know, conducting, waging activism, and in some cases even going beyond frankly the boundaries of nonviolent activism. If we include violence not against humans, no health professional I think would ever do that, but violence against property. The evidence that activism is incredibly important in building both public and political will is really pretty clear. Erica Chenoweth, a professor from Harvard, has written a book called Civil Resistance. Her analysis of how, you know, how regime change happened. She was particularly interested in how regime change from authoritarian to democratic regime change happens, and how authoritarian regimes and even democratic regimes end up making major changes in policy. And virtually in her research, virtually in every case, civil resistance mattered. And she also, very importantly, concludes that nonviolent civil resistance is more than twice as effective as violent civil resistance. So, you know, as the health community, it's hard for me to imagine our health colleagues ever embracing violent civil resistance, but we have seen some instances where they have waged violence against property. I think that's a bad idea. It makes a clear statement, but I suspect it is counterproductive in terms of building public will. But when health voices show up, when health professionals show up en masse to wage civil resistance non-violently, it absolutely can help move the needle. Lots of streams of evidence support that. And then I just wanted to also speak very briefly on the question of who benefits. Like, if this integration doesn't happen, who benefits? And we have to disentangle the integration on the mitigation side and the adaptation side, because the answer of who benefits differs depending on if we're looking at mitigation or adaptation. On the mitigation side, we have an absolute clear answer. The fossil fuel industry petrostates who are, derive the majority of their national revenue off of fossil fuel exploitation. They are the ones who benefit when we do not make progress on integrating. And the fact that the fact that we continue to use to essentially drive our economy based on fossil fuel rather than nimbly pivoting to a clean energy economy, not only are the human health costs profound, but but frankly, the economic costs are profound too, because in most parts of the world, it is cheaper to generate new electricity from clean renewable sources like wind, solar, hydro, and battery storage than it is to produce new fossil fuel infrastructure. And exploration. So that's who benefits from our lack of progress on moving forward on the mitigation front. On the adaptation front, it's a less clear answer, but I guess I would say who benefits are the ideologues who just don't want us talking about the issue of climate change for whatever reasons they have, because they feel it threatens their identity, because they feel it creates their hegemony in terms of, sort of dictating the policy priorities in their country or in their media ecosystem. But that would be the only place where I see really clear resistance to the idea of moving forward with an adaptation agenda.
So I'm going to just put out, we're getting close to the end of Q&A time, but I'm going to put out one more question. Julia did answer it in the chat, but I think it's worth elevating to this research team and allowing you all to weigh in. And that is, having done this research, what key evidence gaps do you still see that are hindering this kind of integration in climate and health? So having conducted this research, what further research needs to be done to help us accomplish, what we want to accomplish in terms of climate and health integration in policy? Where would you all go next? What's your next research project?
I'm going to give the last answer to that question, but I'm going to open it up to my colleagues. Do you have prior answers?
Maybe I can go first, because I think my slide, I tried to allude to it in my slide, the last point of my slide, which was for the Caribbean. This report is a status report. This is where we are, and we had a realization of where we are at this point in time. And because we now know where we are, and we have to figure out what do we do with this? How do we move this forward? So for me, the next step would be trying to determine what policy prescriptions do we need. What are we going to use as our focal point? Is it going to be climate in all policies? Are we going to do a planetary health? Is it One Health? And I understand that it can't be one thing for all of us, because we're different. So the next research question for me is, what should the integrated policy look like? And with that, I would try to look at models where that already exists. And the next question, for me, it's the pathways of moving from the evidence into some actionable items into policy. And it was obvious to me that those pathways are needed. One policymaker actually said to me, I thought when we did our feedback meeting, after the meeting, he said to me, I thought this feedback meeting was going to be around how do we get there? He was happy that we had presented the status, but I think they want to know, how do we get there? So my next, if I was to do another research project on this, it would be, how do we get there? What would work for the Caribbean? And that's where I would go. Thank you. Sorry.
Great. Tim, do you want to add to that?
Yes, okay. We did consider the nature of the sort of evidence and science policy interface with our interviewees, and it was quite a sort of nuanced picture. So without sort of trying to sound too cryptic, I mean, the future, I think the future would be to investigate where the evidence gaps really matter, and what the precise nature of them is. How can evidence be presented and packaged in such a way that helps break the deadlock and pushes policy forward, in particular contexts. I think you can go into more detail into particular sectors and contexts of decision making to work out what the dynamics are there between, rather than just keeping on trying to present more, as we heard from the Diarmid from WHO, you know, more and more technical IPCC type evidence that just becomes steadily refined, but the overall message is clear. Maybe the next stage is to work out in particular cases what the nature of the gap is, and how evidence plays a role in decision making and breaking policy deadlocks as a whole. I've had tried to summarize that in very little time, but I think that's I hope you can see the point that I'm trying to make there. That would be my future research agenda, I think. Yeah. Thank you.
Very helpful, Tim. Thank you. And let me just close very, very quickly on one final point, and that is Julia Fine and Josh Ettinger, who members of our team, they led a synthesis review of all of the published evidence on the question of how do we engage productively, voices outside of government, how do we engage productively with policymakers to communicate the evidence, to advocate for solutions, both in the health space, in the climate space, and in the intersection between climate and health. There are shockingly few studies that have addressed that question, and almost all of them bring tacit knowledge. They're essentially interviews with people who have experience, as opposed to bringing the lens of science to the question. In other words, there has been almost no empirical research on that important question. How do we engage more effectively with policymakers to try to bring evidence into bear on the policy question? So I would end up by saying, I would end my thoughts by saying, we need more science. We need more actual empirical research on how to engage productively with policymakers at all levels of government.
Okay, thanks so much. I'm afraid we're out of time for any further questions. I know there's a lot more to discuss here. Before handing over to Ed for final words, I just want to announce that for those who don't know, this year, the countries are expected to deliver updated, what are called nationally determined contributions, NDCs. These are their national climate commitments under the Paris Agreement. They were due in February, but the vast majority of countries did not get them done by February, so they'll be rolling in throughout the year. GCHA sees this as a really key opportunity to advocate for integration of health into those national climate commitments. So it doesn't get all the work done. You still need, policies on the ground for all sorts of issues in every country, but getting health integrated into those national climate commitments under the Paris Agreement is an important step, we think, in driving this agenda forward. There are a number of organizations that are working on supporting countries to do this. WHO has some great work that it's doing. The Wellcome Trust is engaging on this issue, a number of others. GCHA will also be coordinating work by health civil society around this year-long. So if you're interested, we'll share information. Stay tuned. We'll share information about how to get involved in that. With that, after my little plug for working on the NDCs, I'll turn to you, Ed, to close this out.
Yeah, thank you, Jenny. I just want to close by offering you up a couple of additional resources. And Josh, if you would put the links to them in the chat as I mentioned them. Each of the national reports or the geographic reports that we've talked about today, we're submitting, they're available right now. I'm going to give you a close on the link to the website where you can download them all. We are currently preparing them for peer review. They will be published in a special issue of the Journal of Climate Change and Health, a special issue on advancing and integrating climate and health policy. So for those of you who also are doing research or have perspectives you'd like to share, there's a call for papers at the Journal of Climate Change and Health. The submission deadline is the end of June. In addition, I mentioned that we had done a scoping review of strategies for engaging with policymakers. Somebody asked for the link to that. Josh will put it in the chat right now. Our team also did a review of sort of the published literature on effective advocacy and communication strategies on the issue or on the topic of climate change and human health. So that we will also put a link to that in there. And then finally, I think I will close by reiterating what Modi opened with, the fact that this work is part of a broader suite of activities that Wellcome Trust is funding and enabling. And we can put the link to the Wellcome Trust website, and so you can look at their activities, other activities as well. And with that, I'm going to close on this slide. I'm going to ask you to take out your phone, point your phone at this QR code, and it will take you right to the part of our website where we have the synthesis report and we have each of the national or the geographically focused reports. And with that, I thank you all for attending the briefing today. It's been such an honor to engage with you all, such an honor to do this work. So I wish you all the best.
Thanks, Ed, and thanks to everyone who joined for taking the time to and being interested in these issues. You know, your engagement matters, as was discussed throughout this event. So thanks to all.